Hello, I am Dr. S.N. Goel, consultant neurosurgeon at RG Stone, Pitampura, Delhi. Today, I'll avail the opportunity of guiding people on urological cancers, that is, cancers pertaining to involving the kidney or the bladder or the prostate. First, I would like to discuss and inform about cancer of the prostate. Now, cancer of prostate, to begin with, I would tell you something what a prostate is. Prostate is basically a small gland, almost the size of a walnut, situated just beneath the bladder, and it allows passage of urine from bladder to the urethra. Besides this, it is also the source of almost 70% of the semen, and therefore it is present in all males. And since prostate is an organ which grows with age, so size of the prostate is not of much concern to the society. Now what happens is people generally have the notion a large prostate means it will change into cancer. No, that's more of a myth. Size of the prostate does not dictate whether it's going to land up into a cancer or not. Now generally all people who are above 50, 55, 60, they tend to have symptoms of prostate which are because of practically benign enlargement of prostate. That would be increased urination, more frequency of urine, then you need to get up at night and pass urine more than often. There is a bit of urgency of urine, which probably means you need to rush to the toilet. So, and you may have blood in urine, you may have pain while passing urine, you may leave behind urine into your bladder after you pee. So all these symptoms are of maybe because of benign prostate enlargement, not necessarily cancer prostate. Cancer prostate as such does not have, majority of times it is asymptomatic, but since it's an organ which can be troubled both by benign disease and by the cancer prostate, so not necessarily anybody who has symptoms pertaining to urination is suffering from cancer prostate. Cancer prostate basically more or less is asymptomatic, and when it presents, it may present with because bone pains, that is pain in the bones, especially the spine part, or into the hip bones, because generally it tends to spread into bones. Then you may have renal failure because of cancer prostate, because it involves the ureters and finally the kidneys are shut down and the patient lands up into renal failure. Then you may have blood in urine. So blood in urine, bone pains, loss of appetite, weight loss, renal failure can, along with urinary symptoms, can be manifestation of cancer prostate. To begin with, cancer prostate is one cancer which generally is not lethal over months or years. It may, even without treatment, the patient may live his normal lifespan. The simple reason is, since prostate cancer tends to occur at an age of 65, 70, and majority of patients have lived their life, or even if you have an expectancy of say 10 years or more, you would not be killed by the disease, you may be killed by the natural lifespan. So even if you have cancer, one needs to be active and take treatment rather than get worried. Now the cancer treatment basically depends on the stage of cancer the patient is with. So how to diagnose cancer prostate? Somebody is suspecting cancer, so there are certain investigations which we need to do. One is blood investigation, that is doing serum PSA, which is quite sensitive to pick up cancer prostate. Then second is a general digital rectal examination, which is to be done on the patient, and the consultant would you can suspect cancer prostate depending on the finding of digital rectal examination. Third, and if you have high suspicion on these two tests, an MRI for prostate can be done, and depending on the findings of MRI, you can go ahead and get a biopsy done. So once it is proven on biopsy, then you need to stage the disease, whether it is confined to the organ, that is generally stage 1, stage 2. If it is adjacent to the, if it has gone outside the prostate but in adjacent organs, it is stage 3, and if it has spread to distant organs, it is stage 4. So depending on the stage of the tumor, you need to take care, and majority of times I would say cancer prostate generally tends to present once it is, especially in countries like India, when it is outside the prostate. But if a patient is fortunate to have cancer confined to the prostate, then probably either surgery or watchful waiting or radiation can take good care of him. And if it has gone beyond the prostate into adjacent organs or into distant organs, then probably some sort of hormonal treatment or certain treatments like removal of both the testes can be a good cure for him. So cancer prostate is like, if I would simply tell you, if somebody has to pick up a cancer among all cancers in the body, cancer prostate is generally relatively more of a benign disease because it does not kill somebody in months or years. A person may easily live for could be 5 to 7 years even if he doesn't seek treatment. Second cancer in the urological in the urology I would love to discuss is the kidney cancers. Now kidney cancers as such, they are generally what we call as renal cell carcinomas, and they again, the presentation of kidney tumors I would say is the patient generally presents with blood in urine, and the patient would come to the consultant saying he has passed blood in urine. Second, he may have pain on the side he has tumor. Third, he may have general loss of appetite, weakness, weight loss, or generalized fever. So all these are manifestation of tumor in the kidney. And if it has gone to distant organs like lungs or bones, then he may have respective symptoms like breathing problem or fluid in the or bone pains, etc. Now again, to diagnose renal tumor, it is more of an, I would say, investigation based diagnosis. The investigations required for diagnosing a cancer of the kidney would be an ultrasound, a CT scan, and if you suspect tumor on the CT and ultrasound, a PET CT may be done to rule out spread to the rest of the organs. Once you diagnose cancer in the kidney, then probably you need to stage it. Staging of the cancer of the kidney is again done by these investigations as already told, and generally if the tumor is confined to the kidney itself, not into adjacent organ, the surgical treatment is a good modality to take care. If other modalities for renal tumors are radiotherapy in case of there is high degree of hematuria and patient is not fit for surgery, then radiotherapy may take care of it, or there are certain immunotherapy which is available in today's scenario to take care of terminal patients, which can actually prolong the life of the patient to some extent. So any tumor in the urology tract, if taken care in time, does not shorten a life of a person to a great extent. Thank you.